Imagine you've just come back from a routine blood test. The doctor calls or a nurse leaves a message, and you hear those words, "Your creatinine is elevated." And suddenly, a number on a lab report becomes something that keeps you up at night. If that's happened to you, or to someone you love, I want you to take a slow breath. Because elevated creatinine is not a verdict, it's a signal. And signals, when we understand them, can be answered. I'm Dr. Naira Stein, your senior's health and wellness consultant, and if you or someone close to you is navigating questions about kidney health, creatinine levels, kidney function, what to eat, what to avoid, then I want you to know you are absolutely in the right place. Stay with us because today's conversation could genuinely change how you care for one of the most vital and most underappreciated systems in your entire body. We're going to talk about 3 remarkable fruits, humble, affordable, and backed by real science, that research suggests can support kidney function and help bring elevated creatinine levels down over time. But before we get there, we need to understand what creatinine actually is, what it's telling us, and why what you put on your plate matters far more than most people realize. Understanding the issue, what creatinine really means. The kidney, a filter we take for granted. Most of us go through life without ever thinking much about our kidneys. They sit quietly in the middle of our backs, 2 fist-sized organs shaped like beans, and they perform a kind of work that is nothing short of extraordinary. Every single day, your kidneys filter approximately 200 liters of blood. They remove waste, regulate fluid levels, balance electrolytes, manage blood pressure, and even help produce a hormone that tells your bone marrow to make red blood cells. They do all of this continuously, silently, without a single complaint, right up until the moment they can't. And when kidney function begins to decline, the body does have ways of signaling the problem. Creatinine is one of the most important of those signals. So what exactly is creatinine? Creatinine is a natural waste product. It's produced when your muscles break down a compound called creatine, which they use as a source of rapid energy. The process is constant. Every time your muscles contract, a small amount of creatine is converted into creatinine and released into the bloodstream. Under normal circumstances, healthy kidneys filter creatinine out of the blood with remarkable efficiency and excrete it through the urine. This is why a creatinine blood test is such a useful window into kidney function. When the kidneys are working well, creatinine levels stay within a normal range, roughly 0.7 to 1.2 milligrams per deciliter in men and 0.5 to 1.0 in women, though ranges can vary slightly by laboratory. But when the kidneys are under stress, when filtering capacity begins to decline, creatinine starts to accumulate in the blood. The kidneys are no longer clearing it as efficiently as they should. And when your doctor sees that number climbing, it tells them that the kidneys are struggling. Why this matters so much for older adults. Here's something that often surprises people. Kidney function naturally and gradually declines with age. After roughly the age of 40, the filtration capacity of the kidneys decreases by about 1% every year. By the time we reach our 60s and 70s, we may have lost a meaningful percentage of our kidney reserve, often without any symptoms whatsoever. This is why the combination of aging and other common health conditions, high blood pressure, type 2 diabetes, chronic inflammation, certain medications, can push already aging kidneys into territory where creatinine begins to rise. And once chronic kidney disease progresses past a certain point, it cannot be reversed. It can only be managed. The window of opportunity is early. It is in the mild and moderate stages, when lifestyle and dietary choices still carry enormous influence, that the decisions we make can genuinely slow progression, protect remaining kidney function, and keep creatinine from continuing to climb. the diet-kidney connection. What we eat and drink has a direct, measurable impact on how hard the kidneys must work and how well they can cope with the demands placed on them. Diets high in sodium force the kidneys to manage elevated blood pressure and excess fluid volume. High protein intake, particularly from red meat and processed foods, increases the production of nitrogen waste products, adding to the kidney's filtration burden. Excess phosphorus from packaged foods and colas, high potassium from certain foods in people with already compromised kidneys, excessive sugar and refined carbohydrates that drive inflammation and damage tiny blood vessels, all of these place strain on a system that is already working at reduced capacity. But here's the hopeful side of that same equation. Certain foods actively support kidney health. They reduce oxidative stress in kidney tissue. They help control blood pressure and blood sugar, two of the most damaging forces to kidney function. They reduce inflammation, and some contain specific compounds that appear to directly support the kidney's ability to filter waste more effectively. Which brings us to our three fruits. The three fruits: science, symptoms, and what they do. Fruit number 1, red grapes. The first fruit on our list might surprise you with its elegance. Small, sweet, and deeply colored, red grapes have been cultivated for thousands of years. But it's only in recent decades that science has begun to reveal the extraordinary chemistry hidden beneath their skin. Red grapes are one of the richest natural sources of resveratrol, a polyphenol compound that has attracted significant attention in longevity and kidney research alike. They also contain flavonoids, anthocyanins, and quercetin, compounds with powerful antioxidant and anti-inflammatory properties. The kidneys are particularly vulnerable to oxidative stress. The cells of the filtering units, the nephrons, are metabolically active and generate significant amounts of reactive oxygen species, or free radicals, simply as a byproduct of their constant work. When the kidneys are already under strain, this oxidative burden intensifies, accelerating damage to the very tissue responsible for clearing waste. Resveratrol and the other polyphenols in red grapes help neutralize these free radicals before they can further damage kidney cells. Multiple animal studies have demonstrated that resveratrol supplementation reduces markers of kidney damage and helps preserve filtration capacity under conditions of chronic kidney stress. Human research, while still developing, supports the anti-inflammatory effects of polyphenol-rich foods in kidney disease populations. Equally important is the effect on blood pressure. Resveratrol has been shown to improve the function of the cells lining blood vessel walls, increase nitric oxide availability, and help relax and widen blood vessels, all of which reduces the pressure that the tiny capillaries feeding the kidneys must endure every moment of the day. Chronic hypertension is one of the most destructive forces on kidney tissue, and anything that helps bring blood pressure down takes a meaningful load off these already strained organs. Kidney safety. For most people with mildly to moderately elevated creatinine, red grapes are a safe and beneficial addition to the diet. They are relatively low in potassium compared to many fruits, an important consideration in kidney disease, where potassium accumulation can become a concern. They contain no significant phosphorus load, and their natural sugars, consumed in appropriate portions, do not produce sharp blood glucose spikes. A small bunch of red grapes, roughly half a cup to 1 cup, is a reasonable daily portion. Choosing whole, fresh grapes over grape juice preserves the fiber content and avoids the concentrated sugar of juice forms. Red or purple varieties tend to contain higher concentrations of polyphenols than green grapes. Fruit number 2, blueberries. If there is one fruit that appears again and again across the research on aging, inflammation, and organ protection, it is the blueberry. Small, deep blue, and deceptively powerful, this is a fruit that has earned its reputation many times over. Blueberries are among the richest sources of anthocyanins of any food on Earth. These are the pigments responsible for their deep blue-purple color, but their biological role extends far beyond aesthetics. Anthocyanins are potent antioxidants and anti-inflammatory agents, and they have a particular affinity for vascular tissue, including the tiny, delicate capillaries that supply the kidney's filtering structures. In the kidney, a network of microscopic blood vessels called the glomeruli perform the critical work of filtering blood under pressure. These structures are extremely sensitive to both oxidative damage and chronic inflammation. In conditions like diabetic nephropathy, kidney disease driven by poorly controlled blood sugar, the glomeruli are among the first structures to sustain damage, and their loss is permanent. Research has demonstrated that anthocyanins from blueberries reduce inflammatory signaling in kidney tissue, specifically inhibiting pathways like NF-kappa B that drive the kind of chronic, low-grade inflammation associated with kidney deterioration. Studies in animal models of chronic kidney disease have shown that blueberry supplementation reduces kidney fibrosis, the scarring process that permanently reduces filtration capacity, and preserves kidney function markers over time. Beyond the kidney directly, blueberries have a well-established positive effect on blood sugar regulation. They improve insulin sensitivity, the body's ability to respond appropriately to insulin, and reduce post-meal blood glucose spikes. Since hyperglycemia is one of the most aggressive drivers of kidney damage, this effect carries real clinical weight for seniors with diabetes or prediabetes alongside elevated creatinine. There is also the matter of uric acid. Elevated uric acid in the blood, a condition called hyperuricemia, is increasingly recognized as a contributor to kidney disease, not just gout. Compounds in blueberries appear to support the kidney's excretion of uric acid and reduce its accumulation in blood and tissue. Kidney safety. Blueberries are genuinely one of the most kidney-friendly fruits available. They are low in potassium, low in phosphorus, low in sodium, and carry a relatively modest glycemic load. For patients on a renal diet, they are frequently recommended by nephrologists and renal dietitians as a safe and beneficial food choice. Around half a cup to 1 cup per day, fresh or frozen, provides a clinically meaningful dose of anthocyanins and related compounds. Frozen blueberries retain the vast majority of their antioxidant activity and are often more affordable and accessible than fresh, making consistency easier over the long term. Fruit number 3, cranberries. The third fruit on our list has a long and well-deserved reputation for urinary tract health. But its benefits for the kidneys, and specifically for creatinine and kidney function in older adults, go considerably deeper than most people appreciate. Cranberries contain a unique class of compounds called proanthocyanidins, specifically A-type proanthocyanidins that are structurally distinct from those found in most other fruits. These compounds are responsible for cranberries' most famous property, the ability to prevent certain bacteria from adhering to the walls of the urinary tract. But the value of cranberries for kidney health extends beyond infection prevention. Chronic and recurrent urinary tract infections are a significant and often overlooked driver of kidney damage in older adults. When bacteria ascend from the lower urinary tract to the kidneys, a condition called pyelonephritis, the resulting inflammation and immune response can cause direct, cumulative damage to kidney tissue. For seniors, particularly women, this pattern of recurrent infection and subclinical kidney inflammation represents a meaningful pathway to declining kidney function over time. Cranberries' ability to reduce bacterial adhesion and the frequency of these infections therefore has a direct protective effect on the kidneys themselves. But cranberries also act as potent antioxidants. Their polyphenol content, including quercetin, myricetin, and ursolic acid, reduces oxidative stress in kidney tissue, and has anti-inflammatory properties that complement those of both red grapes and blueberries. Some research suggests that cranberry compounds may help reduce the accumulation of oxalate crystals in the urinary tract, a factor in kidney stone formation that itself causes kidney damage. There is also emerging research on cranberries' effects on blood pressure. Studies have found that regular consumption of low-sugar cranberry products is associated with modest but meaningful reductions in systolic blood pressure, again, directly reducing one of the most damaging forces on kidney microvasculature. Kidney safety and an important caution. Here it is important to be precise, because cranberries are sometimes avoided by people with kidney concerns, and this warrants clarification. Cranberry juice in its commercial, sweetened form is high in sugar and often contains additives that are not kidney-friendly. This form should generally be avoided. However, unsweetened cranberry juice, diluted with water or consumed in small amounts, and fresh or frozen cranberries themselves are low in potassium, low in phosphorus, and appropriate for most people with mildly to moderately elevated creatinine. Cranberry supplements are another option, but anyone taking blood thinners, particularly warfarin, should consult their physician before adding cranberry in concentrated supplement form, as there is a potential interaction. For those without this concern, around a quarter cup of whole, fresh, or frozen cranberries daily, or a small glass of unsweetened cranberry juice diluted with water, is a reasonable and beneficial amount. These fruits are supporters, not substitutes. I want to say something clearly here because I think it matters enormously. These 3 fruits are not a cure for kidney disease. They are not a replacement for medical treatment, prescribed medications, or the guidance of your nephrologist or primary care physician. What they are is evidence-informed support, dietary choices that work with your body's own repair mechanisms and with your medical care, not instead of it. If your creatinine is elevated, the most important thing you can do is understand why. Is it driven by high blood pressure that isn't well controlled? By blood sugar that spikes too high too often? By chronic use of medications that are nephrotoxic, harmful to the kidneys? By dehydration? By an inflammatory condition? The answer to that question shapes everything else. Diet is one powerful pillar of kidney protection. It is not the only one, but it is one that is entirely within your control, beginning today. Alongside these 3 fruits, there are broader dietary principles that the research consistently supports for people with elevated creatinine or early kidney disease. Reducing sodium intake is one of the highest impact changes most people can make. Excess sodium raises blood pressure and increases the kidney's workload significantly. The target for people with kidney concerns is generally no more than 1,500 to 2,000 milligrams per day, a level that requires attention to processed, packaged, and restaurant foods, which are by far the largest sources of hidden sodium in most diets. Moderating protein intake, particularly red meat, processed meats, and very high protein diets, reduces the nitrogen waste burden the kidneys must filter. This doesn't mean eliminating protein, it means choosing plant-based proteins, fish, and poultry over red meat, and discussing appropriate protein targets with your healthcare provider. Staying well hydrated supports the kidney's ability to filter and excrete waste. The color of your urine is a simple and reliable guide. Pale yellow indicates good hydration. Darker yellow suggests you need more fluid. However, people with advanced kidney disease or heart failure may have specific fluid restrictions. Always follow your physician's guidance on this. Limiting phosphorus from processed foods, colas, and packaged products reduces the burden on kidneys that can no longer manage phosphorus balance effectively. And managing blood sugar through diet, activity, medication, or all 3 remains one of the most impactful interventions available to anyone with diabetes and kidney disease. How to incorporate these fruits practically. Integrating red grapes, blueberries, and cranberries into a daily routine doesn't require dramatic change. A small bowl of red grapes as an afternoon snack. A half cup of blueberries stirred into plain Greek yogurt or oatmeal in the morning. A quarter cup of fresh cranberries blended into a smoothie, or a small glass of unsweetened cranberry juice with water at lunchtime. Consistency matters more than quantity. The protective compounds in these fruits, the polyphenols, anthocyanins, resveratrol, and proanthocyanidins, accumulate in tissues over time and exert their effects through sustained, regular presence. Eating blueberries once a week will not move the needle. Eating them daily over weeks and months creates a biochemical environment that genuinely supports kidney tissue. And it's worth noting that these fruits combine synergistically. Consuming a variety of polyphenol-rich foods together tends to produce greater antioxidant and anti-inflammatory effects than any single food alone. A morning routine that incorporates all three, even in small amounts, is not only practical but genuinely therapeutic. Monitoring and working with your healthcare team. If you have elevated creatinine, one of the most empowering things you can do is request regular follow-up tests, not out of anxiety, but out of engagement with your own health trajectory. Creatinine levels, eGFR, estimated glomerular filtration rate, urine protein, blood pressure, and blood sugar together paint a picture of kidney health over time. Tracking these numbers gives you and your doctor the information needed to adjust your approach. Ask your doctor about referral to a renal dietitian if your creatinine is significantly elevated. These specialists are trained precisely in the nuanced dietary management of kidney disease, including the appropriate amounts of potassium, phosphorus, protein, and sodium for your specific level of function. What is safe and helpful at one stage of kidney disease may need adjustment at another. And please, if you're taking supplements, herbal products, or making significant dietary changes, tell your healthcare team. Some supplements marketed for kidney health contain ingredients that are actually harmful to compromised kidneys. Some herbal products are nephrotoxic. Your doctors cannot protect you from risks they don't know about. Here's what I want you to carry away from this conversation. The kidneys are resilient. They are patient. They have been working for you without complaint for every year of your life. And even when they are under strain, even when creatinine is rising and the numbers are not where they should be, there remains meaningful room to support and protect them. The three fruits we've discussed today, red grapes, blueberries, and cranberries, are not exotic, expensive, or complicated. They are accessible, affordable, and grounded in real science. When consumed consistently as part of a broader commitment to kidney-supportive eating, adequate hydration, blood pressure management, and blood sugar control, they contribute to an environment in which kidney tissue is better protected, oxidative stress is lower, inflammation is calmer, and the kidneys have a fighting chance to maintain their function for longer. That's not a small thing. That is the difference, over years, between independence and dependence, between quality of life and the complications that steal it. Your kidneys have been quiet partners in every moment of your life. They deserve the same quiet commitment in return. Start small. Start today. A handful of blueberries, a small bunch of red grapes, a splash of unsweetened cranberry juice in your water. These are not sacrifices. They are investments. In your kidney health, in your vitality, and in the years you still have ahead of you. I'm Dr. Naira Stein, and I'm honored to be part of your health journey. Look after your kidneys, because everything else depends on them.